to come to your aid when you need it. Do the emergency lines in this country even work? For answers to these and more, join me, Nuong Falong, on MX24. Hello, good evening and welcome to Spotlight on MX24 television. My name is Nuong Falong. We've been off for some 2 weeks and I'll tell you why. COVID finally caught me and was able to get me down for 2 weeks. But we're back here. We have defeated COVID. And if you've been following the news, you know that there is something out there that's being called the fourth wave of COVID-19. But what are the actual figures? What is the situation that we're in? And is Ghana poised to defeat this wave of COVID-19? Who better to speak to than the Director of Public Health at the Ghana Health Service, Dr. Esiedu Bekoy. I'm sitting in his office right now. Hello.
Hello.
Happy New Year.
Happy New Year.
Have you had COVID before?
No.
How? What have you been doing right?
Oh. I think that I try my best to adhere to protocols.
Okay.
And actually, I'm a fan of wearing the mask.
Okay.
And then I've been vaccinated. So I won't say that it's 100% proof, but that's what I've been doing. So I'll try to maintain that.
So I am vaccinated. I also try to observe the protocols. But a few weeks ago, I woke up with a sore throat. And, you know, a bit of headache here and there, and then some body pains. So I decided to test. Luckily, I had a few self-test kits. So I tested, it was positive. And then I went into the lab tests, which also came out positive. And I was, I don't know if I was surprised, because I kept wondering where I could have picked it up from. But it was what it was. So I had to just try and fight it. Luckily, I am here today. Feeling very well. But out there, what is going on right now? Do we have a fourth wave of COVID-19?
Yes, thank you very much. Yes, apparently we are actually in the fourth wave. Because if you want to look at our trajectory of the disease since it started March 2020, you could see that there was an initial spike. So that one was the first one, which we call the first wave. And that one was the initial part of the pandemic. So at that time, we had the early virus, which maybe we call the Wuhan virus. That one was the one that came from China. So that one, we realized that for Ghana's situation, it spiked around maybe like June, July, and after that, it started coming down. So somewhere like September, we start getting a flattening of the situation until late December. And that was the time they had a new variant, which you call the Alpha, or the one that came from the UK. So that one came the second wave. So we realized that somewhere like this year, last year, we started getting some cases, but they became more profound after the end of the Xmas, or after the New Year. So that was the second wave. And then it also stayed for about 2 months, and then soon after March it went down until we had the next one, which is the Delta variant. That one actually somehow originated from India. So that one was around like June, July, and then it also came down. So it had been down, and then until somewhere in November, we had a new variant, which is Omicron. Okay. So we realized that when there's a surge, it tends to coincide with the appearance of a new variant, because that's the changing factor. Because people are not actually changing their lifestyles, but then when you have a more virulent organism, then it causes a surge in cases. So for now, as I speak, Ghana, for the past like 3-4 weeks, we've had this surge in cases. I think it's about the highest since we started, because now we are even be able to get about 1,000 cases a day. If you look at previously, when we get surges, it's maybe maximum 800. Now we've been getting 1,000 cases.
I saw the figures, and I was alarmed because when you're counting 1,000 cases a day, these are not the actual figures. Yeah. These are even official figures.
Yeah, these are reported cases.
Yes, and we know that there are people in the communities, in their homes, who are not testing, are home treating. Some people think they're vaccinated, so they cannot even get COVID-19. And so it means the actual figure is even more frightening. When Ghana went into lockdown, we didn't have that high number of daily records. Is it time for lockdown?
No. You see, that lockdown period was the early stages of the pandemic. At that time, there was very little known of the disease. At that time, there was no issue about vaccination. So you realize that the system is now a bit more resilient than it used to be in the time past.
There's more knowledge.
Yes, yes. So I think that there's no. To me, lockdown is the end result, the end point. I don't think we should. Yes, the last resort. I don't think we should think about that. We have measures we can put in place to mitigate against this high surge in cases. I think that one thing which is somehow good is like if you want to compare, let's say the first wave and the second wave and this one, they are similar in character. It's like we have a lot of cases. Reasonable number of them are asymptomatic or mild. Compared to the second and third wave, that was very severe and had a lot of mortalities. So for this one, it's early days yet, but you realize that the number of severe cases, fine, they are now starting, but if you look at the numbers, in terms of proportion, they are a bit on the lower side.
Well, there's also a fusion of, the Delta and the Omicron. How is it possible that someone can contract both at the same time?
It's not really. You see, I think that what the viruses try to survive. And normally viruses, when they are in a virus for a period of time, they get weakened. So if you look at the trend of the cases, that's why it starts going down, because the human beings get used to it. In that case, the virus gets weaker, and then they mutate and get stronger forms, so that they can survive better. So that's how, if you look at the last work that was done by one of our genomic sequencing groups, somehow it appears that the Omicron is replacing the Delta. Yes, and I think that this is not going to be the end of variants in this pandemic. Maybe after the next 2-3 months, there will be another variant. But the issue is that when you have a variant which is more virulent, then you have more cases, and that is it. So what is good for us now is that somehow the vaccines or the non-pharmaceutical intervention work. So whether it's alpha, beta, or gamma, or delta, or omicron, the same principles of intervention are the ones that we are using.
When you talk about the vaccines, there's a target for that. How is that going? Are we set to achieve the targets that we've set in vaccinating the population?
Yeah, so I think that we started with a target of 20 million Ghanaians, let's say by the end of the year.
Was that ambitious?
No, I think that, you see, the idea is to try and get a large number of your population protected.
Right.
So you aim for the best. And if you at that time, so now we are looking at about 66% of the Ghanaians being vaccinated. That will give a somewhat herd immunity. So that was the target by the president. But as we started, there's a global absence or shortage of the vaccines. So you want to vaccinate your people, you are not getting the vaccines. So that was there's a period of drought until I would say like 2 months ago that we started getting the vaccines. So now we have in cumulative terms, we have about 24 million doses of the vaccines.
Will 20 million Ghanaians be vaccinated by the end of this month?
No. I think that the president has even changed the target, because it's like you want to do it.
There are limitations.
Yes, there are limitations. So we are still aiming for it, but how soon we need to go for it. But luckily for us, we have the vaccines. So the challenge is getting Ghanaians to take it. It's different from when you have the vaccines and you're aiming for it. Now we have the vaccine, so we need to see how best the Ghanaians can take the vaccines.
Is it the vaccine hesitancy that is slowing down the rate of vaccination?
I think that there's I'll say that I'll label the hesitancy in two ways. There's a real hesitancy and there's an apparent one. You see, the apparent is whereby people feel lazy, or they think that they have to stand in the queue for a long period of time to go and get it. So why do you want to do it? So that kind of laid back. But there's a few people who have, based on one or two beliefs or myths, don't want to go for it. And let me say that. So if you look at our approach for the vaccination, that's why we actually was led by the president to convince the Ghanaian that the vaccines are safe and they're efficacious. And then immediately realized that almost all the big pastors and the archbishops, whether it's charismatic, whether it's Orthodox, they were all Pentecostal, they all took it. So to galvanize the Ghanaian to buy it. I think what we was a challenge for us was the absence of it. So it took away the initial enthusiasm. You know, when we started, I mean, everybody was calling you, where can I get a vaccine? And after some time, 4 months, 5 months, no vaccine.
There was nothing.
So now it's about weakening the Ghanaian, which is a challenge. But we're hoping that
to renew interest in
yes,
in
so we're hoping that we can push and push more. Let me say that when the Omicron came, initially we pushed people a bit that hey, the disease is not gone, so let's go for it. So we hope to ride on these high figures to get Ghanaians vaccinated.
There are some people who are already vaccinated and they're looking for booster shots. Are those available yet?
Yes, so boosters are not a new kind of vaccines. They are just the vaccine that we have. Yes, that you see, normally the antibody titers will wane after a period of time. Normally after 6 months, you realize that the levels of antibodies in you are low. So we try to now kind of keep up the immune system again. So that is the principle. But then we're also trying to look at population protection. So you don't need to just get 5% of Ghanaians fully vaccinated, whereby like 95% of them are not vaccinated. So we are doing a trade-off. We want a lot of Ghanaians to get the vaccines, and they will add onto the boosters. But let me say that we are very soon, our National Technical Working Committee on Vaccines, the NITAC, they are coming clear with a guide about who people will be vaccinated, particularly for the boosters. And we are looking at...
How soon is very soon?
Oh,
because people like me are looking for boosters.
No, I think that they finished their meeting yesterday. So they will submit their report to the minister, and then the minister will give the direction. But we have some guide, you know, which people are more at risk of getting the disease, which people are more likely to die when they get it.
At this point, aren't we all at risk?
No, yeah, yes, but some are more at risk than others. And then some are more at risk of getting severe form of the disease than others. Right. So we realized that when we started the vaccination, that's why we use what they call the geographic and then the population segmentation. Because some people are more likely to get it. Let's say if you're a health worker, your risk of getting the infection is much more than you. You understand? And somebody who's 60 years and above is more likely to die than a young person. So we look at all those things to influence the boosters, but they will come. So very soon the boosters will come.
Some people think that the reasons they're not testing is because testing is expensive. Because if you go to the hospital, for example, you have no insurance and you want to test. I think the lowest I've seen is about 250 Ghana cedis. The ordinary Ghanaian cannot afford that. So what they do, they sit at home and then they treat themselves with maybe what their friend used when they had COVID. If not tested, we are not sure. It's also affecting the official figures. Don't you think it's time for us to have self-test kits out there that people can easily access, perhaps at a lower cost than the test, and be able to test themselves?
Okay, so so let's say when we started the pandemic, we had an approach where we tried to do that what they call the hands contact tracing. The idea was to have an idea of the extent of spread of the infection in the community. After some period, we got convinced that the virus is not imported, it's in the community. So we minimize that approach. So we're now starting with a symptomatic approach. So somebody has symptoms, and then he goes to a health facility, then you test the person, then you identify the contacts, and you further test. So that process is still free. If you feel that, am I getting COVID, and I go to a hospital, when you do the
any
test,
hospital?
yes, it's free. And then
you mean government hospitals,
yes,
right?
And then your contacts, they are also tested free. It becomes you pay when you decide that you want to do the test. So I think that's going to be the challenges. But now we have actually introduced the antigen guidelines. So hopefully, where you have a lot of antigens, then it will be a bit cheaper because the antigen is included.
You know, in other countries, these things are available and people are able to test.
Yes. So we will continue to update our protocol.
Is it a possibility?
Yeah, I think that what we intend doing for this surge is to get a lot of people using the antigen as a first line before we do the PCR, because the antigen is quicker. You understand? So give us an idea, could it be COVID? You do it, it's possible, then you confirm with the PCR. But so if you have, let's say, an outbreak in the workplace, we will test you with the antigen. Or if you have a workplace, or if you have an outbreak in the school, we'll start with the antigen. And those that are positive are the ones that will confirm with the PCR. So I think that is our approach for it.
For this particular surge, have you recorded any increase in hospitalization as compared to previous ones?
Let me say what is very different was the number of severe cases were low, but for the past 2 days we've seen an increase. So it's early days yet for assess. But then in terms of proportion, you realize this one is relatively low in terms of severity. But I'd say this early days, you see, it depends on who is getting infected. If you have a very young person getting COVID, it's likely to be mild or asymptomatic. But you have an elderly person who has an underlying medical condition, they may have a very severe or maybe die. So that's where the issue is. That's why we should try as far as possible not to infect others, particularly when you have elderly relatives.
Doc, this new variant, which is Omicron predominantly, where did it come from into the country?
No, for now, we are not sure where it came from. You see, if you look at the Ghana setup, our objective is to minimize or stop importation. For clearly, the virus will come from outside. So that's why we try to set up this system at the airport. So we say guidelines for international travelers. So the first one was that before you come to Ghana, you need to do a PCR test. You need to be negative. The second one is that you do the antigen test at the airport. Let me say Ghana is one of the few countries that does that. What it does is that it tries to minimize the people who have the infection from entering the country. It just minimize. But there are people who may be asymptomatic, who may be incubating, and then they will now enter the country. So it's just a way of minimizing the people who are entering the country. So even if you look at our initial results, I think about 4 weeks ago, we said 34 people detected at the airport. That was just at the airport. You understand? We are not sure of those who have sneaked through. So though we don't have a lot of evidence of Omicron in the community, the presence of the surge in cases is a demonstration that you have Omicron.
How strict are the protocols at the airport?
Yes, our airport, I think that a few weeks ago it was said that Ghana has one of the strictest guidelines in terms of COVID preventing infection to the country. Because we have 3 layers. Okay. You need to be doubly vaccinated, you need to have a PCR test, you need to have antigen test at the airport. I mean, most countries don't do that. Some do only 1, some do 2. But we have 3 layers. The idea is to minimize the importation of the infection into the country.
When people are found to be positive at the airport, what happens? What's the process?
Yes, so if you are positive, we'll take your passport.
Okay.
You understand? And then before you take it, you will be assessed. So you are assessed to find out your clinical state. Are you asymptomatic? Do you have symptoms? You find out, are you a Ghanaian? You understand? So it has implications. If you are symptomatic, it means that you need to immediately be sent for treatment. If you are asymptomatic, then we need to put an isolation. So the isolation, there are 2 ways, 2 pathways. the Ghanaians go into the National Isolation Center at Pantan, and that cost is borne by the government. So whether you spend 3 days
for now,
yes, borne by the government. Then if you're a foreigner, then you go to what you call a bit of what you call the isolated hotels, and that hotels are private hotels
owned by people.
Yes, and I think that people want to say that we have interest, we don't have interest. Even the hotels are not ready to host anybody who has COVID. So we have to now beg and
it's a partnership.
Yes, so that they try and keep them. So we have a number of the hotels and the price range. So you go there, and then when you go there, the third day you do a repeat test. If you do a repeat test and you are negative, you go home. You are kind of discharged. If you are still positive, then you stay to the day 7. So at the end of day 7, then you are discharged by the medical team. So that is the process.
So what happened in the case of Biniman?
Yeah, Biniman. So let me say that the protocol applies to everybody.
Okay.
So you come to Ghana, you are tested. If you are positive, you're
quarantined.
You are supposed to send to an isolated hotel.
Either as a Ghanaian or a foreigner.
Yes. So as far as you're concerned, he was found positive, and then normally they go with a bus. A bus sends them to
the hotel.
The hotels. Yes. So from the records, he's checked into the hotel, but I think somehow he managed to sneak out. But then, because I said, because you have your passport, before you get your passport,
because immigration had his passport.
Yes, as I said, before you can get your passport back, you need to be discharged by the doctor.
Okay.
So he didn't have the discharge. So when we were going for the passport, they said,
where is your discharge?
Where is your discharge? So that's the issue. So there were things in between, but for our system.
But he brought a document that showed that he had now tested negative, something like that.
That is for him, but not for us.
Right.
We have our system in place that if you are found positive, you go to our isolation center, we repeat the test after 3 days. So if you disappear.
But you're aware he didn't wait for 3 days. He was out there.
Whatever he did, I'm talking about the health system. Our health system is that you are positive, you go for isolation, day 3, you repeat your test. If you are negative, the health system will discharge you. So if you go and do a test, then it is for your own doing. It has nothing to do with us. You understand? Because that will not lead to a discharge.
Doc, but why this issue concerns me is that he was out in the public. So what, in that situation, what does the country do as sanctions to ensure that people do not become impudent and try to do the same thing?
Yes, thank you. So I think that this has security issues, you understand? But we also have to recognize that there are Ghanaians who aided him. And I think that, you see, I don't know what people want to achieve, whether they want is selfish interest at the expense of the government or the country. Because Biniman doesn't know Ghana.
Yeah.
Yes, so it means that there are Ghanaians.
We should care more about Ghana than foreigners.
Yes, so I hope you are speaking to the Ghanaian that we should cut away our interest. Because let me tell you, Premlam, this disease is a pandemic and it doesn't respect anybody. And I was telling some weeks ago that to me, the entertainment sector must even trumpet the message more than even the health sector. Because it has implications on them. If you look at all the concerts going on, they could have been cut off. Yes, because of the high numbers. So I think that we should get a bigger view of the pandemic that we are. Don't let's see it as a health event. Because the implications cuts across all sectors. So I think that for Biniman issues, they have some security concerns that the security will handle. But from our point of view, later on he was brought back, he was tested, it became negative, and so we were discharged. Okay. We were discharged from our end.
All right. Does this suggest that there is a possibility that there are people out there who are positive and are able to sneak through the system?
Well, do
we need to develop another way of tackling that? Because how do we find these people?
Now, so let me say that normally the hotels or the isolation centers have security guys there. So it's not common that you can sneak out. Because what happened was that when the surge came, we had a bit of challenge about placing some of the military guys, security guys, that early. So I think that in that transition, the people saw some gap, and then maybe that's what I'm thinking. But before you are considered as an isolation center, there are some certain features that you need to have. You understand? So, so there's the whole isolation is a collaboration between Ghana Health Service or the health system, immigration, and security to ensure that there's sanity.
Thank you, Doc. You forgot to mention Ghanaians. The ordinary Ghanaian is also part of the collaboration to ensure that COVID protocols are adhered to. You're still watching Spotlight. We're speaking to the Director of Public Health at the Ghana Health Service, and he has just reiterated the need for people to observe protocol, for Ghanaians to protect fellow Ghanaians, and for us to be serious enough to understand that the COVID-19 disease out there affects us all, especially the entertainment industry. Your cooperation is also needed in maintaining sanity as Ghana continues to fight COVID-19. We're going on a quick break. When we come back, the conversation continues. Stay with us.
Across Africa, nations are beginning to trade among themselves like never before, creating the largest continental market the world has ever seen. On the Single African Market Program, we will show you how products, services, capital and people will be crossing barriers as the continent and its citizens embrace a single market in a sustainable manner for growth and development to meet targeted UN development goals.
Congratulations, Your Excellency.
Get the latest update on all opportunities from the Continent's Trade House. Know the success stories and how challenges are being addressed. Africa is ready to trade among itself and the world, so are the people. The Single African Market is the voice of businesses that trumpets the vision of Africa everywhere, in association with the Government of Ghana, International Chamber of Commerce, Business for Peace Foundation, GIZ, UNECA, and UNDP.
The Single African Market, this Monday at 8 p.m. on MX24.
Technology is evolving rapidly, from machine learning, automation to artificial intelligence. All of these can be quite hard to keep up with, right? Plug in now as I, Eddie Kusin, ushers you into the advancing world of technology on Tech Today.
The only show custom built to cover technology with experts from every corner. Tech releases, gadgets reviews, apps, and many more. Coming live right here on MX24. You've got questions, we've got answers.
Welcome back to Spotlight. Let me say Happy New Year to you again. We're speaking with the Director of Public Health at the Ghana Health Service, Dr. Franklin Esiedu-Bakoy, who's been taking us through some of the figures relating to COVID-19 presently in Ghana and how Ghana is tackling the pandemic. Doc, there have been some suggestions that at the current rate we need to start doing mass testing. Is this something that's possible? Is this something we even have the capacity for?
Mass testing. I see, I think that the principles still suffice. You see, I live with the notion that the next guy is positive.
Okay, yeah, that's a good way to approach it.
So in that case, I need to prevent myself.
It's your job to protect yourself.
Yes. So I think that is because if you want to do this mass testing, there must be daily testing because your status is dependent on the day you did the test. So if you do a test today, and you are negative,
can get it 1 hour later.
Yes. So is that the issue? Let's focus on the preventive methods. Rather than the testing is a good way of finding out whether you have the infection, but I don't think that we can sustain it and they also want to. So it's one other way, but one sure way for me, is let's adhere to protocols. You vaccinate and then you also adhere to protocols. Then you are not likely to get infection.
But schools are reopening soon.
Yes.
Are we going to be improving upon the protocols we have? How are we going to tackle that aspect? Because that's massive.
Yes. So apparently, so it's a whole partnership between Ghana, Ministry of Health, and then Ministry of Education. So we work together, and then it's about making sure that the staff are well knowledgeable. We have systems in place. We have the logistics provided for the schools. The key issue is early detection. So you detect a child who has infection, and then you inform the health system, and then we will respond. So it's a whole setup that exists. So far it has not been bad. Just let's say a few weeks before vacated, we didn't have an active case. I mean, there was a lot of anxiety last year when we were going to open the school because the cases were going up and we were going to open school. But I think that the partnership, the collaboration between the two sectors worked. So I will continue to make sure that all the logistics that they need, medical buckets, hand washing facilities, the PPEs will be in place. And then we will also encourage them that they actually maintain their good personal hygiene.
What happened with the beaches? One moment we said beaches were closing, next moment we are opening beaches. Are we not sure what we're doing?
No. I think that, let me say that there was this meeting last week, the Regional Security Council of Greater Accra, and I think at that meeting it was discussed that let's not open the beaches. And so somehow the beaches were closed as much as possible during the Christmas. And so we had another meeting yesterday, and the idea is that, okay, can we, because the beach is an open space. If you look at the president's speech, he said as much as possible events must be held in the open.
Okay.
Do you understand? So the beach is also an
open space.
So if we can maintain that same environment, then we should make sure that the beaches are open. So we met them and make sure that, okay, fine, the beaches will be open, but there must be a big collaboration. Let me say that most of the events, the well organized ones, is a collaboration between Ghana Health Service, the Ghana Tourism Authority, and then the event organizers. So they are supposed to ensure that the environment is COVID-free. Okay. So likewise, that's what we want to do for now.
We know that recently also, flights from Accra were suspended by Emirates Air. Are you privy to the situation that informed this? Apparently we have quite a high number of positive cases going out, and they decided to close that path. Is this what happened?
Oh, no. I think that is a case which is being investigated, and we had a meeting yesterday to look at what proportion. You know, we have the labs are supposed to. You see, one thing is that you can have a test result changing over a period of time.
Of course.
Yes, because I mean, it depends on when you did the test.
And you're treating yourself anyway.
Yes. So the idea is that we are also looking at our labs to see whether something untoward is happening.
Okay.
And I think that to us is a case which is being investigated. Because normally before you are accepted as a COVID-19 testing lab, there are some processes you need to go through. First, the equipment must be approved by FDA. The facility must be inspected by HEFRA. And then we also try and look at your data management system. So the idea is that your data needs to be seen by us. So those are the three things. So we are looking at all the labs to see whether there are any gaps to assure quality assurance. So to me, it's an issue being investigated.
Do you believe in compulsory vaccination?
No, we are not doing compulsory vaccination in Ghana. Okay. What we are saying is that we want many Ghanaians to be vaccinated.
Okay.
And we say for a start, we are using what they call a vaccination mandate. So we say the people who are more likely to get it, and the areas who are more likely to get it, we need to make sure that it's mandatory. So we have actually designated some people that we think that they must get the vaccines. So we say health workers, we say all security personnel, government and parastatal employees. Those are people that we think that they must mandatorily get vaccinated. Now we also have selected some venues, the stadia, closed restaurants, those are areas that we think that, with the beaches, we should be thinking that before you go there, the risk of infection is high. So before you go there, get vaccinated. I mean, that is the directive. And hopefully, it will come into place somewhere in January. We are not so certain about the date. That's why we try to precede it with the vaccination month, to make sure that a lot of Ghanaians are vaccinated and to get the necessary population immunity that we need for protection. So for us, it's not about compulsory vaccination, it's about making sure that we get a high number of Ghanaians vaccinated. See,
we have a lot of protocols. The worry emerging is, are we adhering to all of them? For example, the $3,500 US surcharge on airlines that bring in positive passengers. How have we been proceeding with that, enforcing it? How many have been charged so far?
Oh, I know a few of such cases have occurred.
Okay.
Yes, because I know there was one case that they brought in positive. I don't know how it came.
Okay.
Because normally you shouldn't bring somebody who is positive into the country. So normally you have to pay. So there, I think I've seen 2 or 3 of such cases. See, the airlines, is not their interest to do that, but maybe 1 or 2 slips can occur. So I think it's working. And we have a lot of collaboration with the airlines. We have meetings to discuss the challenges about implementing the protocols. They also tell us their challenges, how they go about it. Like this directive, the one about the entry based on vaccination. You know, if it was supposed to be effective on the 12th, we met them and they said no, 12 is too close, so we have to do it on the 14th. So we actually engaged to get the best.
What about these events? You know, this holiday season, there have been so many events. Some of them, you see the videos. People have their mask off, they're dancing together, they're sweating, there's no social distancing. Are the organizers going to be sanctioned in any way? Are you collaborating with these organizers even before the events? Because if you are, how are they flaunting the protocol so much?
So the world organized ones is done in collaboration with Ghana Service, Ghana
Ministry of Tourism,
and then the organizers. So there's a protocol that was actually designed by these 3 people that was shared to them long ago. So I think they probably returned to December or something. So it's a whole protocol looking at various aspects of events. So we go in Ghana Service to check whether you are conforming to the protocol that we agreed upon. And as I said, some of the well organized ones, they actually go through. I remember the Samini concert like that. We went there. Initially, it was also like at the dome, which was enclosed. So you had to tell them to move some of the parts. So it became like a partial open space. I remember the GT Bank one. That was the first concert. We had a lot of discussions to make sure that the capacity is about 25%. We worked until about 2 a.m. that the people broke the gate. So some of the organized ones, apparently there's a lot of engagement. There are some ones that I don't know how they care about, but I think those are the challenges. But clearly, the tourism authority told them that it has implications, because if you are flouting the rules, it's going to affect other events. So I think that it used to be more engagement. There were issues, but you see, somewhere like August, September, the caseload was very low. So it was a kind of an agreed that these events can take place. Unfortunately, I just feel,
now it's fine.
So it became like a bit of a trade-off between the losses and then the health issues. So you have to try and play between the two and see what can happen.
No, why don't we just suspend all these events? Because we know that this is a huge avenue of spread.
Now I think that most of the events were modified. You see, that's why the idea was, I said the president said it clear, that the events must be outdoor. I mean, that was the directive. So as far as possible, we're not supposed to do indoor events. If you are indoor event, and then it's become an illegal issue. But if it's an outdoor, which is a directive from the president, then we try and see how best it can be done. But one thing that I see, I think that this whole fight against COVID, people don't see it the way I think they must see it. It's an individual issue. It's about your life. It's not about the government. You understand? To me, the government has done so much, provided vaccines, provided health facilities, provided medicines, PPEs. What is your contribution? As an individual, what is your contribution? Contribution is wear the mask. Contribution is that get yourself vaccinated. Contribution is get yourself distant for your next door or your neighbor. I mean, that is your contribution. Because you see, if you don't look at it in that context, you may get an infection, you may be asymptomatic, but your auntie or your grandmother will die because he has an underlying condition. So I think that when you try to narrow it down to yourself, rather than looking at the government, you start asking yourself, what is the government doing? What is the government doing? Ask yourself, what is your role in the fight against COVID? And I have said it again, that the fight against COVID is not we and them. Just like, what are you doing? It's about we. And every person has a role to play. So whether a media person, whether a doctor, whether an entertainment organizer, you all have a role. And that mentality must sink in.
You mentioned health facilities. Our health facilities up to task to be able to, these cases we're recording and the way the figures are going, our health facilities ready?
Yeah, so I'm saying for now, fine. But you see, if the cases keep on going up, then there's going to be a challenge. And unfortunately for us, quite a number of health workers too are getting infected. So that's going to be the...
They are human.
Yes, that's going to be the challenge. Because some of them are tired, some of them are fatigued. So if we keep on getting more cases, they're going to stretch and overstretch the health system. And I think that's why I want to plead with Ghanaians that we can curtail the effect of COVID. So let's minimize it. Let's get it minimized from ourselves, from our friends, and from our relatives, and not the elderly ones.
Is it possible for any new variants to develop or emerge in Ghana?
Yes. I mean, so we do genomic sequencing on a regular basis. And they try to look for the kind of viruses they get. So normally you see the variants, there are so many of them, but they have two types, whether it's a variant of concern or variant of interest. And it normally becomes of concern when it has public health implications, leading to more spread of cases, leading to more fatality. In that case, you say, hey, what is causing that? Because they actually see every time, because they are viruses, they're always mutating. But which ones are causing more cases, which ones are causing more death, then it becomes an issue. So clearly, our labs, Gucci, Wagpec, they are all doing, now most of, even our friends lab is also doing genome sequencing. So it becomes very necessary and it's of concern which we identify.
Is there a record of how many health workers have been infected?
I don't think I have it offhand, but I think it should be more than 5,000. I have to check, but it's quite a number. So even if you look at the recent times, a number of them have been infected. So you are not immune. Just and the fact that you're a health worker does not mean you cannot get infection. If you are not conforming to the rules. You see, one thing is that at times you can meet your friend, and that's to be the disadvantage. Because it's your friend, and that's the time you are not wearing a mask. Because in some cases, people have the symptoms and early stages, they are not clearly disclosing it. And as they sneeze and cough, you may share it. So your health worker does not say that you cannot get infection.
We used to have a COVID-19 tracker. Do we still have one? Is it operational?
Yes, so a number of apps have been around, some are dormant, but we have the tracker, and then quite a number of them. So some is like you log in, and then you can use to assess your status, whether you are ill, and then it's to give an idea of where you should go. I mean, so I think that some of them have gone down for now, but the other countries they may have a tracker that will give an idea, particularly if you are in isolation, whether you are moving out within a particular circumference. So I think we use some of it in the early stages of the pandemic to give us an idea of those who are isolating. So I'll say that there are quite. Just recently we tried to use the vaccine app to give us an idea whether we can get our own appointments. So a number of apps have been used on and off during the pandemic. Maybe we need to revisit some of them.
We also see that throughout the record of these increasing cases, some regions have not recorded too much. For example, the Savannah region, they have recorded some 263 cases. Is this a population issue, or are they doing something differently from the other regions?
COVID is about numbers. It's about movement. It's about space. It's about population. So if you have a very large space, naturally you are physically distant. So your risk is minimal. If you are not aggressively moving up and down and meeting people, you are protected. So it gives yourself some natural protection. So most of these regions that are sparsely populated, that don't have a lot of economic activity, have their own natural protection. Like it can be a place like Accra, and there's congestion, people are sitting in church together, then you are likely to get the infection. So those are the main reasons why they have less cases.
Doc, what does the future look like?
No, I think that, to me, the future is good when we all get the good understanding of how we want to address the pandemic. Let me say it's a pandemic. We are not sure when it's going to end. So we need to take it very seriously and then stop looking at what people can do. Let's look at what we can do. Because as I said, it's about creating awareness. It's about getting people vaccinated. It's about behavior change. So those things, we need to have it together. And as I said, there are a lot of companies or sectors that will collapse if COVID does not halt. So if you have that mindset that your industry can collapse, you need to be on board. Let's all get on board. Luckily, we have a lot of vaccines. We can get ourselves vaccinated, and then we'll build the necessary population immunity. And then I think that we can overcome the stress of COVID-19.
Doc, I've enjoyed this conversation. I've learned a few things also. And at least your commitments to fighting the virus is admirable. Do you have any closing remarks?
Yeah, so my closing remarks is that the fight against COVID-19, I want to go back to it. It is not we and them. So that you are criticizing the system. It's about we. And each Ghanaian or each resident in Ghana has a role to play. The idea is that what role are you playing? And I think that look beyond yourself, consider your elderly relatives, the effect it can have on them. And then with that mindset, I think that we can overcome the threat and the challenge of COVID-19.
Thank you so much. Dr. Franklin Esiedu Bekoy. Did I leave anything out?
No, fine.
And to you at home, thank you for sticking with us. We just concluded a conversation with the Director of Public Health at the Ghana Health Service. The core question here is, what is your role in the fight against COVID-19 in Ghana? At the end of the day, it's a collective effort. What are you doing yourself to help curb it? So we can go forward into a new year without disease. My name is Nwong Falong. This is Spotlight on MX24 Television. Once again, Happy New Year. See you again next Monday, same time. Good evening.